Hello and welcome to this 9th Global Summit from Admitech. And we are now starting off with topic 1, state-of-the-art and future directions in smart prostate cancer screening. And in this session, you will hear from several of the leading investigators of large-scale trials and initiatives. You'll hear from Peter Albers about the ProBase trial, Monique Robol will tell you about the PraceU consortium, Jonas Hugosson will talk about the Göteborg 2 trial, Ansi Auvinen about the ProScreen trial, Anders Bjartell about the organized prostate testing program in Sweden, and Ryan Gabe about the Transform trial in the UK. And I'm Sigrid Carlsson, and I'm head of the Division of Clinical Epidemiology of Early Cancer Detection here at the German Cancer Research Center in Heidelberg. And I will now give you a brief overview about advancing risk-stratified screening and early detection for prostate cancer. As you know, we can expect a global surge in prostate cancer cases with changing age structures and improving life expectancy. So prostate cancer is really a public health burden across the globe. We are facing several challenges. We know that people continue to die of prostate cancer despite available screening. There's a lot of one-size-fits-all or wild opportunistic testing, and this is associated with costs, inequity, and harm. What screening tests do we have? Well, we used to rely in the past on the digital rectal examination, but the ProBase trial here in Germany, led by Professor Albers, has shown that it has a notably low diagnostic value as a screening test for prostate cancer alone. We, of course, use DRE as part of the workup for elevated PSA. But as a screening test, we have, of course, the much better blood biomarker, the PSA test, which has been around for a long time, and it's very common. And men do want to have a PSA test. So, for example, here in Germany, over 70% of men over 55 have had a PSA test. And PSA often gets a bad reputation, but it actually has an exceptionally strong prognostic value as a marker of future risk of lethal prostate cancer. So this is data from the Malmö study in Sweden, where we can see that men age 60 with a PSA less than 1 have a very, very low risk of developing metastases or dying from prostate cancer by age 85, and no further screening is needed for those men. We are also now facing a really fascinating paradigm shift. We have now more advanced risk prediction models, novel biomarkers in addition to PSA. We have very advanced imaging and artificial intelligence, and this allows us to tailor screening to be more risk stratified. And there is really now a climate for this type of targeted screening in Europe. We see that not only for prostate cancer with the PraceU and the Transform trial, but also for breast cancer and lung cancer screening. And also the same is being seen now for colorectal cancer screening and others as well. And PraceU, you will hear about from Professor Monique Robol, is a large initiative in the EU with 7 countries already participating and 13 more set to follow, including Germany. And you will hear from Anders Bjartell about the organized prostate testing, which is the Swedish part of PraceU. And you will hear from Professor Auvinen and Hugosson about the ProScreen trial in Finland and the Göteborg 2 trial in Sweden in Göteborg, which has shown that combining the PSA test with the 4K score before MRI and then followed by targeted biopsy can maintain the detection of clinically significant disease and halve the risk of overdiagnosis. And at the same time, you reduce resources, you'll have less demand for MRI and fewer biopsies. So it is definitely much more helpful for all the men being screened in this program too. So this is a really compelling strategy moving forward in terms of risk stratification. And MRI really has been a game changer. It's almost always being done before a prostate biopsy because it improves the balance between benefits and harms of early detection. It maintains the detection of significant disease, it reduces overdiagnosis, and it reduces unnecessary biopsies. But it's important to remember that the chain is only as strong as its weakest link. So here's an example from the ProBase trial that shows that more experienced radiologists have better predictive accuracy in terms of reading MRI. So the experience really matters here. And also, of course, the equipment and the entire setup. AI also holds great promise in helping to interpret the prostate MRI images and can improve the diagnostic accuracy, and also in future screening programs holds promise to save resources and reduce disparities by being a more objective measurement. What also has potential is microultrasound that proved its worth in the Optimal trial led by Professor Lawrence Klotz. And this is really shown to be non-inferior to MRI and could be kind of a one-stop shop for diagnosis without having the complexity or cost of MRI. So it could be very appealing for urologists to have a micro-ultrasound machine that can help do better and safer biopsies and be more accessible. So it's one potential screening tool in this diagnostic pathway. And with that, I say thank you and auf Wiedersehen for now, and we will move on to the next speaker in this session. Thank you.